Hi, my name is Gary. Today we're going to talk about starting IVs. Before we get started, I wanted to share with you a little bit of story, a little story that happened to me when I first got started at EMS. I was working an ALS rig in downtown Portland, a transporting rig, and back in those days we took turns every other call. Whoever drove to the scene, drove to the hospital, and whoever was in the passenger seat took the call. It really didn't matter if it was an ALS or a BLS call. That didn't really enter into the situation. So we got dispatched to a shortness of breath call, and on the way, my paramedic partner asked me if, he said, when you get there, ask him if he has any chest pain, and if he does, give him a nitroglycerin. That'll open up his lungs and make it easier for him to breathe. So I got down, and I had, although I was only an EMT basic, I had a pretty good understanding of ALS calls. So I asked the patient if he had any chest pain. He said he did, so I opened up the nitro and popped the nitro under his tongue. And we loaded him in the ambulance. I put him in the back. I climbed up in the back with him. And on the way to the hospital, my partner, a very experienced EMT, he said, Gary, why don't you put him on the monitor as long as you gave him a nitro? I said, okay, I can do that. So I hooked him up to the monitor, and I'm taking further history, and I'm evaluating my patient. He said, you know, you probably ought to put an IV in him since you gave him a nitro and you got him on the monitor. And I looked up in the mirror all wide-eyed, and I said, Greg, I don't know how to start IVs. He goes, you know, oh, don't worry about it. We're almost to the hospital. We'll be okay. So we dropped off the patient, and we went back to quarters, and my partner said, so you don't know how to start IVs? And I said, no, I've never started an IV. He said, well, let me show you something. And he sticks out his wrist, and he grabs his wrist like that, and pops up his vein right here along the wrist. He goes, this is called the intern's vein, because it's really big and really easy to hit. He said, go get a 14 gauge. So I went in the back room, and I got a 14 gauge catheter out, and we opened it up. And as you know, 14 gauge is a pretty good size catheter. Looks about like the filler of a ballpoint pen. And he said, all right, so here's what you do. The hardest part is going through the skin, he said. That's where it hurts. And so you just do it. Just get it over with. Just go through the skin. And then you're going to go through the vein. You're going to feel a pop, pop. Just two little pops. One's through the skin, one's through the vein. And just get through the skin and just be assertive and make it quick. So I cleaned his wrist with an alcohol swab, and I took that big old 14 gauge catheter, which I think you can see right there, and held back the skin, and went pop, pop right into the skin, got a flashback, threaded the catheter in, and he said, great, now you can start IVs. Now that was the old days. That was a long time ago. We don't do IV training like that. I did go through schooling later on, an advanced module on airway and IV starts, and obviously went on to paramedic school and learned how to start IVs the right way. Today we're gonna learn this the right way. Basically, the goal of this class is to teach you the proper methods and procedures for an IV start. The objectives of this class are to understand why IVs are started, to discuss the risks and the benefits, not just to the patient, because obviously your patient has concerns and there are risks to your patient, but we also want to talk about some of the risks and the concerns to you as the care provider. We're going to demonstrate the proper procedure, and we're going to define appropriate management after that IV is started. The equipment you're going to need are going to be an IV catheter, IV fluids, a drip set, tourniquet, alcohol swabs, tape, Band-Aids, and some sort of offside or Vena guard, depending on what your agency might be using at the time. Best of all, we want to talk about why IVs are started. Medications. Best way to give IV or give medications is through IV site, fluid administration, and obviously, in case your patient deteriorates, prophylactic therapy. There are certain risks that you need to be aware of when you are considering starting an IV. That would include infection, bleeding, fluid overload, medication errors, pain, necrosis. And to you as a provider, you always need to be concerned about bloodborne pathogens, infections, and of course, career-ending errors. Um, we don't like to think of it in that manner, but there are obviously errors that you could make that could end your career in EMS. Infection can come any number of ways. It can come through the tubing, it can come through the IV site, it can come through the catheter itself. You can have contaminated fluids, contaminated medications. There's any number of ways that you can get an infection. The nosocomial infections are a really big issue in healthcare right now. Basically, nosocomial means it's a hospital-acquired, and for our sake, we would call it a could be ambulance provided, it could be care provider acquired disease, um, and anything that happens during the patient's care. Generally, these will show up within 3 to 5 days. The direct costs of nosocomial infections currently are running about $4.5 billion per year, and it gets worse. According to the CDC, 1.7 million patients annually, or roughly 1 in 20 patients, will contract a hospital-acquired infection. And of those, 99,000 patients will die from that infection. Other things that we need to be concerned about, obviously, are bleeding, fluid overload, especially in pediatric patients or elderly patients. You do not want to be giving your patients too much fluid that could do further harm to them. Pain is obviously a concern, and necrosis from a infiltration or something like that. For us, bloodborne pathogens, either through direct skin contact, through a needle stick, a dirty needle stick, contaminated needle stick, or even blood spray or blood spatter. Infection of ourselves, and as we mentioned, the career-ending infections. A coworker of mine a couple of years ago scratched herself on the gurney as she was putting the patient into the back of the ambulance. She ended up getting an infection in her hand that they could not stop. It was a